This is a short introduction to your Medicare choices. And when it comes to Medicare, you do have some choices to make. But first, let's take a look at how Medicare works. Part A of Medicare is hospital insurance. It has a deductible. It has no premium. And it covers hospitalization, skilled nursing facilities, home health services, and hospice. And there are some additional charges that come into play if a person is in the hospital for a long time. Part B of Medicare is medical insurance. It has a monthly premium. And some people will pay a higher premium if their income is over $85,000 per year. Part B has a deductible. Part B pays 80% of doctor bills, ambulance charges, emergency room charges, chemo and radiation costs, and most non-hospital medical services. You pay 20% of these bills, and there is no cap to your 20%, which can result in large and never-ending medical bills. Avoiding financial disaster due to medical bills is why you have choices to make about your Medicare coverage. Deductibles and the 20% coinsurance are gaps in Medicare, and some people fill these gaps with a Medicare supplement. Medicare supplements are also known as Medigap plans. Medicare supplements don't have fancy names, they have letters. Plans C and G are popular because they fill most, but not all of the gaps in Medicare. Plans K, L, M, and N have lower premiums because they fill fewer gaps and leave you with more bills to pay. Plan F fills every gap in Medicare. I tell my clients, think F as in full coverage. Because Plan F fills every gap, it has the highest premium. So, you got your Medicare, and you've got a Medigap plan or Medicare supplement, and then you should get a Part D drug plan. Now, you don't absolutely have to enroll in Part D, but if you don't enroll in a Part D plan when you're first eligible, you will pay a late enrollment penalty if you enroll 1 year down the road or several years down the road. So what does this type of coverage cost? There's the Medicare Part B premium, and then there's your Medicare supplement cost, which depends on the plan that you choose. A 65-year-old can get a Plan F in Arizona for, and then there's the cost of a Part D drug plan. If you take only generics, a lower cost plan should work for you. But if you take one or more brand drugs, more expensive drugs, you'll get lower overall cost by getting a higher premium plan. There are over 20 Part D plans available in Arizona, and that makes choosing a Part D plan a bit confusing. And I've come across quite a few people who've been on Part D for a while, and they're paying way too much for their plan because they got it and then never looked at it again. So, buying a Medicare supplement and a Part D plan, it's one way to get your Medicare coverage. But there is another way to get your Medicare coverage that is a little bit different, and that is Medicare Advantage, also known as Part C of Medicare. Medicare Advantage plans look a lot like a really good employer health insurance plan, and they are offered by insurance companies which have a contract with Medicare. If you enroll into a Medicare Advantage plan, you are choosing to get your Medicare benefits through that insurance company. Most Advantage plans in Arizona have no premium. Almost all Advantage plans include Part D drug coverage. Almost all Advantage plans in Arizona offer a free gym membership. and some, but not many, offer some dental benefits like cleaning twice a year and x-rays once a year. So, how does Medicare Advantage work? Well, most Advantage plans in Arizona are HMOs, and that means they have networks of doctors, hospitals, labs, etc., and you can only use providers who are in the network and contracted with your Advantage plan. Referrals are required to see a specialist, and tests like CAT scans or other diagnostic tests require prior authorization from your plan, just like your employer plan. Let's see. We do have some PPOs in Arizona, not many, and they do have significant premiums. Referrals are not required in PPO plans, but the PPO stands for Preferred Provider Organization, so they would obviously prefer that you stay in network. Now, all Advantage plans have copays or coinsurance for medical services you receive, such as doctors, labs, hospital admittance, physical therapy, chemo, and radiation treatment. If you're considering enrolling in Medicare Advantage, you need to ask some questions. Are your doctors in the network? How are your prescriptions covered, and at what cost? One Advantage plan might have a $45 copay for a brand drug that you take, while another plan's copay for that same drug could be $90. So you need to pay attention to those details. Each Advantage plan has a maximum out-of-pocket, which is a good thing because it protects you from large and never-ending bills. In Arizona, MOOPs range from $2,800 for one plan to $6,700 for a couple of plans. So, in summary, you have two ways to get your Medicare coverage. One way is to use your Medicare card and buy a Medicare supplement and a Part D plan. I call this the pay in advance system because you pay monthly premiums and then have no copays or limited copays for your medical bills. I call Medicare Advantage the pay-as-you-go system because you have no monthly premium, but you have copays when you go to the doctor, or if you get physical therapy or diagnostic tests, or if you end up in the hospital. I'm sure you have lots of questions about your Medicare choices, and I can answer them for you. I have over 10 years of experience helping people understand Medicare. So call me or email me, and I'd be happy to answer any questions you have. I can help you get a Medicare supplement and a Part D plan, or a Medicare Advantage plan, whichever type of coverage you decide works best for you. I look forward to talking to you.